Hello, everyone. My name is Jocelyn, and this is my pathogen presentation on gonorrhea. Neisseria gonorrhoeae, also known as gonorrhea, is the second most commonly reported notifiable disease in the U.S. It is a gram-negative coccus-shaped bacteria with diplococcal arrangement. It is oxidase positive, making it aerobic, meaning that the bacteria can use oxygen as a terminal electron acceptor during respiration. Some of its virulence factors include the elaboration of pili, which allows the bacteria to adhere to surfaces, facilitating infection. OPA and pore protein expression. OPA-associated proteins are integral outer membrane proteins, while pore-associated proteins, also known as porins, allow the transport of ions and nutrients across the outer membrane, as well as contributing to the survival of the bacteria in hosts. LOS, which stands for lipo-oligosaccharide expression, present in all gram-negative bacteria. Gonococcal LOS is toxic to fallopian tube mucosa. In addition, LOS can render the bacteria resistant to certain normal human bodily responses or serums. And lastly, IgA or immunoglobulin A protease, which aids in the bacteria's survival within the human body. Moving on, the disease itself is transmitted in a handful of ways, those being vaginal, anal, or oral sex. Expecting mothers infected with the bacteria can also pass the infection along to their newborns, becoming quite apparent from birth to about a week after due to noticeable buildup around the eyes, semi or total neonatal blindness. There are lots of misconceptions surrounding the transmission of STDs, but rest assured, gonorrhea cannot be spread through shaking hands, hugging, sharing a beverage, or public toilet seats. Signs and symptoms of gonorrhea are a little different for women and men. Women are most likely to experience vaginal bleeding in between periods, pain or a burning sensation when urinating, and an increase in vaginal discharge. Men can have a wide range of symptoms, most commonly discharge of any color, soreness in the affected area, bleeding, painful bowel movements, and anal itching. Signs and symptoms usually tend to appear within 1 to 14 days after exposure to the bacteria. However, most infections are asymptomatic, with the American Sexual Health Association stating that upwards of 90% of all gonococcal infections present with no symptoms. The morbidity of gonorrhea has risen dramatically over the last 20 years due to the rise in antibiotic resistance. With so many cases of gonorrhea going untreated due to lack of symptoms, long-term infection complications are common and for women can result in PID, also known as pelvic inflammatory disease, chronic or lifelong pelvic pain, infertility, and less commonly ectopic pregnancy. For men, those long-term infection complications can include epididymitis, prostatitis, and proctitis. Thankfully, gonorrhea very rarely leads to death, making statistics on the mortality of the disease quite scarce. There are a few tests that can be utilized to identify the bacteria causing gonorrhea. Your doctor could ask for a urine sample or a swab, or both. If your doctor does suggest a urine sample, first catch tests are usually the most accurate, meaning the first part of the stream is the only part collected. Once collected, the lab is then able to analyze the sample for the presence of the bacteria. One way that a lab may choose to analyze a urine sample is through the use of urinalysis dipsticks. Dipsticks that pop positive for leukocytes or increased number of white blood cells indicates either chlamydia or gonorrhea. Gram staining and viewing under a microscope can provide more certainty after the fact. Gonorrhea nucleic acid amplification testing can also be done on a urine sample or swab to detect the DNA of the bacteria causing gonorrhea. This is the quickest and easiest test for this type of infection and is preferred by medical and healthcare professionals. There are a few treatment options for gonorrhea. It is very easily treatable when diagnosed. Most gonorrhea infections used to be treated with a small supply of oral antibiotics. Now, with the rise in antibiotic resistance, doctors recommend a one-time intramuscular injection of 500 milligrams of ceftriaxone. And just that one-time injection should be enough to clear up any of the bacteria inside your system. For oral gonorrhea, your doctor could prescribe any number of successful antibiotics. There's at least 4 or 5 that are known to kill off the bacteria completely, and usually about a week's supply is enough to do the trick in that scenario. New data surfacing on gonorrhea in Australia. Researchers there have found that open mouth kissing can be a way to transmit oral gonorrhea in a study done primarily surrounding gay and bisexual men. That's it for now. Thank you everyone for listening, and I hope you enjoyed.